Hello, welcome to All About Kids, a program focusing on the interests of children and young people and some of the issues affecting them. Our guest today is Jim Ramstad, Minnesota's congressman from the 3rd District. He'll be talking with Chuck Oberg of the American Academy of Pediatrics Minnesota chapter and also the assistant director of the Hennepin County Medical Center.
Well, good day. I'm Chuck Oberg, and I'm a pediatrician with the American Academy of Pediatrics, and I will be your host today for this session. I'd like to introduce our very special guest, Congressman Jim Ramstad from the 3rd District. Congressman Ramstad has been in the U.S. House of Representatives since 1990, representing us. In addition, prior to that, was in the Minnesota legislature, was Assistant Minority Leader in the House, actually in the Senate. And it's just really a pleasure to have you with us today.
Thanks, Chuck.
Welcome,
Good
Jim.
to be here.
Yep. One of the things that I know that you're on a couple of very important committees in the U.S. Congress. One is Ways and Means, and I know that that's a very prestigious and important committee. You're also the founder and co-chair of a caucus on medical technology that I may ask you about a little bit later, but I'd like to start with just really talking about an issue that you've really spearheaded in the last couple of years, and that's the whole issue of crimes against children. And with that, I'll just ask you how you got interested in that topic and really what's happened in the last couple of years on this very important issue.
Well, I first started working on those issues when I was in the state senate here in Minnesota back in 1981. I've always thought children were the most underrepresented of any of our population in terms of the legislative process. They don't have the high-paid lobbyists that most groups have, and nothing that affects me more than crimes against children. So when I went to the Congress, I continued my efforts. In fact, last year was fortunate to get 3 of my child protection bills included in the omnibus crime bill, which passed the Congress and was signed by the President. The first one was the Jacob Wetterling Child Protection Act, which requires convicted child sex offenders to register with the police after they're released from prison or parole, and also provides for community notification. One of these child predators moves into our neighborhood or any neighborhood, the neighbors will be notified, the schools will be notified, the child care workers will be notified. People should know when a convicted child sex offender moves into their neighborhood, and that's what that bill provides, the Jacob Wetterling bill. And I might add that that bill would not have passed without the efforts of Patty Wetterling and people associated with the Jacob Wetterling Foundation. They came down and walked the halls of Congress with me for 4 years to get that legislation finally passed. The second bill that became part of the crime bill that is now law was the Child Sexual Abuse Prevention Act. That deals with child pornography, the importation of child pornography, and also the practice of child sexual, they call it sexual tourist business, the pedophiles who go abroad and abuse children. There are some unscrupulous companies in the United States who provide flights and hotels for Americans to go abroad and abuse children. So we made that a crime and provided the enforcement mechanism to deal with that growing problem. The third bill was the Assaults Against Children Act that was brought to me by federal prosecutor at the time, Tom Heffelfinger. Very big problem, especially on the Indian reservations in Minnesota. Children were being abused, physically abused, cigarette butts in their faces, some wounds that weren't permanent in nature, but certainly were very, very harmful and grievous. And the prosecutors weren't able to file criminal charges except for a misdemeanor, 3.5-month or 3-month misdemeanor charge, 6-month misdemeanor charge, I guess it was. So we increased the penalties and made any crimes against children on federal lands that result in substantial injury. That's what we changed in the law, as opposed to permanent injury, which was the law before. Simple change in the law, but an important change for children, especially on federal lands. So those are the 3 bills, Chuck, that were included in the crime bill to protect children. Very important legislation, and just grateful to be here today to say we were able to get them enacted into law.
Well, they are very important, and they are law. Are they actually in effect now, or will they be staggered? So that
they are in effect now. The President signed the bill late last fall, and they are the law of the land.
That's excellent. Maybe you could just address the whole issue that I think many people think about, which is why things that seem so important and have so much common sense behind them would take 4, 5, or 6 years when they're being discussed and debated within Congress or out in Washington.
Well, that's a very good question. Of course, it goes to the heart of the legislative process. It's a slow process. The Congress moves like a glacier sometimes in addressing these social problems and other problems very slowly. Inherently, it's a slow process. We have the subcommittee process, the hearings, the committee process, bills in a bicameral legislature that we have in Congress have to pass both bodies and then get signed by the President. So I think the Wetterling bill provides probably the best illustration of that. We worked long and hard with Patty Wetterling and others from Minnesota for 4 long years on that bill, which, like you said, seems to be a matter of common sense to notify people when sexual predators move into their communities and to provide registration for these people. In fact, the average child sex offender commits 187 such offenses, these heinous offenses, before being convicted the first time. That's according to the FBI crime statistics. This is a major problem, and of course that's how we justify such registration requirements because of the high rate of recidivism on the part of these criminals.
Well, we're really proud that you've worked on that effort, and again, I think it reflects what Minnesota does. I think many times people look to Minnesota as really working as a model for public policy changes and for things that need to be done. There's been a lot of talk with the onset of the 104th Congress about the contract with America, and a lot of scrutiny in those first 100 days. I'm not sure where we are right now. We're probably around 200 or so, but could you just maybe give the audience and myself an update about where things are at with the contract and things that have been passed or are presently being discussed, and maybe focus it in on those issues that really address the needs of kids?
Sure. Well, we're certainly working hard, and we're keeping our promises in that contract and making some major changes, which I think in the big picture of things will be better, not only for children but for all Americans. First of all, we're trying to bring some fiscal sanity to the process. We've had too much wasteful spending in Washington over the last 10 or 12 years. We now have a $5 trillion national debt. So the average family that I represent here in Minnesota is paying $400 a month in federal taxes that go to pay the interest on the debt. That's what it means for the average family that I represent, $400 a month that go to interest on the debt. The average baby born today incurs a debt of $187,000 that he or she must pay an interest during their lifetime to the federal government. That's clearly unacceptable.
Those are empty dollars. Those are empty expenditures. You get absolutely nothing.
Absolutely.
When you're starting to address
in fact, in paying the $235 billion annual interest bill, the federal government sends a third of that money to Japan. Those bonds are held by the Japanese, so it absolutely does nothing for our economy. It's just a total drain, and you can see how that's preempting investment capital and taking dollars that should be spent on worthwhile programs like the WIC program, like the DARE program, like Head Start, and some of these important children's programs. Instead, we're paying interest on the debt to the tune of $235 billion a year. So that's the overriding principle that we're working within. The overriding objective of the new Congress is to try to balance the budget and to do it in a compassionate, humane, common sense way. What we're going to do to balance the budget in 7 years through the contract with America is to hold the overall growth in spending to about 3% per year. Some programs we're increasing. In fact, I brought a list, some of the important programs. Again, the overall growth is going to be held to 3% per year. If we do that over 7 years, we'll zero out the deficit by the year 2002 and eliminate and start bringing down the debt. Some programs are going to receive a bigger increase. For example, the Child Protection Block Grant. Funding will be increased from $3.6 billion this year to $4.4 billion in fiscal year '96 and $5.5 billion in the year 2000. The school-based nutrition block grant program, school lunches, is going to be increased 4.5% each year between now and the year 2002. And 80% of those funds are going to be required to go to children from needy families. We're increasing the family nutrition block grants from $3.5 billion this year to $4.6 billion next year and $5.3 billion in the year 2000. We're increasing breast cancer screening by 25%. That's been an underfunded program, and women of this country are obviously being terribly impacted by breast cancer. We need more screening. We need more prevention in that area, so we're putting more money into cancer screening. WIC increases under our program. So you can see that we're being selective. We're holding the overall growth in spending to 3% per year, but in the areas of particular need, some of these children's programs, we're increasing spending significantly more.
Let me follow up on that. As a pediatrician, I see a number of kids with very special needs, either educational problems or medical problems. Some of these kids are technology dependent. I think there's a lot of confusion out there as we move into this new federalism and move from entitlements to block grants, and we start to shift how things are actually being delivered. How are we going to assure that some of those special needs kids, in fact, maintain the services that they need?
We are going to assure that because people like you and others who care about children will be going to the state legislature and to the Hennepin County commissioners and working together in a collaborative way. You'll structure these programs. You'll tailor the dollars that come from Washington to meet the local needs. Now, we think the county commissioners and the state legislators can do it more cost effectively and more efficiently at the local and state levels, as opposed to letting the bureaucrats administer the programs from Washington. Not to mention the fact that we can save a heck of a lot of money by doing it that way. So that's why we're returning the money in the form of block grants to the states and letting the states tailor the programs to suit the local needs. We think it can be done much better through this mechanism by sending the money back and the authority back to the local levels.
That really speaks to the advantages to, again, the block grant concept. Being somebody in Minnesota, what are the things that we need to be aware of to watch for really maybe some of the possible disadvantages as that transition occurs, so that we can really keep an eye on that and make sure that the kids with special needs are going to get their needs addressed?
Well, I think it behooves all of us at the local and state levels to be diligent in establishing contacts with state legislators and county commissioners. Those who care about children, children's advocates need to have their voices heard and need to work together, as I said, in a collaborative way to structure these programs. And I think the people at the local level, at the state level, are eminently qualified to design sound programs that can be better administered more effectively, as well as more cost efficiently. So I think this is a way to go. I think we've been working at the federal level in the Ways and Means Committee, for example, in welfare reform, working with the governors like Governor Carlson, who's been a leader in this area, with Governor Engler, Governor Weld, Governor Wilson, the Democrat Howard Dean from Vermont. We've been working very closely with the governors in developing the block grant concept. And the governors like it, the state legislators like it, and I think the people, more importantly, will like it because of the flexibility and because of the ability of people back here in Minnesota to tailor the programs to meet the specific needs of the population. I mean, we might place more money into child care here in Minnesota than a state with a more aging population without as many children. So be it. That decision should be made back here in Minnesota and not by the bureaucrats who promulgate the rules and regulations in Washington, some 2,000 miles away. So I'm optimistic about these programs, that they can be devised. I know there's some skepticism out there, and we have our critics, and that's fine. It helps us to do a better job. But I think when all's said and done, the welfare system, as we all know, I think needs reform. We've spent $5 trillion now, federal taxes, since 1965 on welfare. We have the highest percentage of people in poverty at any time in the history of our nation. We have the highest percentage of illegitimate births, children, I should say, born out of wedlock at any time in the history of our nation. We have the highest percentage of illiterate people in the history of our nation. The welfare system has not worked overall and needs some fundamental changes. And what we're going to do is provide work requirements and instead of handouts, and we're going to mandate that after 2 years of job training, education, that recipients who are able-bodied get a job. And you know, I just came from a meeting with a number of welfare recipients, and they look forward to getting a job. They don't want to be held captive by a welfare system and held down. They want to better their lives and their children's lives. I just met with about 20 welfare moms over here in Plymouth, and they want the resources certainly to make the transition from handouts, if you will, to work, so that they can have a better life for their families and themselves. So generally people have been very, very supportive of what we're doing, and we think that this is clearly the way to go.
Yeah, I would agree. I think everyone wants an opportunity to succeed, and we have to find out ways to allow them to do that. Since you mentioned the welfare reform piece and actually the issue of poverty, an issue that's really concerned me in the last few years is I've kind of used the analogy that if we were back in 1980 and looked ahead to where we were now in 1995, I think we would be really amazed and actually rather saddened by what we see. I mean, there's more kids living in poverty now than there has been since the late 1950s, 1960s. And what that means is what's become commonplace is we've got more and more, children and families are the fastest growing segment of the homeless population. We've got food shelves, which were initially designed as kind of a transitional effort for some of the recessions back in the 1980s, have been institutionalized. What can we do to really address that impoverishment of our families and kids in conjunction with the welfare issues, so that when we look ahead 5 years or 10 years from now, we don't see a continuation of those trends, but in fact we've actually done something very important for the lives of these families and kids?
Well, I know firsthand about what you're speaking, Chuck. Back then I helped start the Lake Country Food Bank, and I know the demand on the food shelves that bank services today. In fact, just was in Brooklyn Center at a food shelf not long ago, and certainly the demand in our suburban areas is great as it is in the inner cities. We do have great need out there. I spent a lot of time riding with police officers to get a first-hand knowledge of what's going on out there on the streets, and I've seen the effects of crime and of some of these programs on children. I mean, the saddest thing of the whole, the saddest aspect of the whole drug and crime epidemic is the effects on little kids. I've been on search warrants, the so-called crack raids, when the cops go through the door of these crack houses, and to see these cocaine-addicted babies through no fault of their own who acquire the addiction of their mother, the crack babies, to hold them and feel their tremors. I mean, you do it obviously in your practice as a pediatrician, but then to follow them to St. Joseph's Protective Shelter and then into placement, it's just unbelievably sad to see the effect on babies and little children of what's going on out there. We have to do things better. We have to devise programs that really reach the people who need the help, the vulnerable population. We're not doing a good job of that at the federal level through the federal bureaucracy and the Department of Health and Human Services in Washington. We think that by targeting the resources more locally, which we're trying to do, and to target them to the needy population, truly needy population. I'm not talking about these rip-off artists who prey on the system. I'm talking about the truly vulnerable children and adults. We think the block grant system is a way to do that, because we think the local officials are more attuned to what's going on in their communities and are closer to the people by definition. It's easier for the people to come to go to St. Paul or to go down to Minneapolis to meet with the county commissioners than it is for them to come to Washington, for example. Now, maybe I'm an exception because I try to get back to Minnesota every week, and I hold numerous town meetings and go nonstop when I'm back here trying to meet with as many constituents as possible. I was just at Cornerstone over in Bloomington hearing the needs of battered women and their children. Visited the food bank again, visited Sharing and Caring Hands again, and talked to Mary Jo Copeland about the recent changes there and the opening of Mary's Place. You talk about addressing problems. Now here's a primary example, because I think an important point that needs to be made is that we can't leave these problems just to the government. The government doesn't have all the answers, let alone the resources to deal with these problems of poverty, of child abuse, of hungry people and homeless people. We've got to look to the private sector, and here is the classic example, the best example I know of in the entire country, of individuals, church groups, private citizens, corporations working together to get at these some of these problems. Mary Jo Copeland, through her leadership, I call her the Mother Teresa of Minnesota. What a wonderful woman. Through Mary Jo's leadership, Sharing and Caring Hands raised $5.5 million, all private dollars. And believe me, they got a lot of contributions, $1 and $2. These weren't all big contributions. In fact, most were small contributions. $5.5 million to build this transitional shelter for homeless people and their families. 200 beds. And I was invited by Mary Jo to come down and help dedicate the facility. And what a great feeling to be there with constituents and friends from throughout the Twin Cities area who had a role in this, and to see the gratitude in the people with these needs, and to see the pride in the people who participated through volunteer hours or through contributions in doing this. So I think those of us in public service have a very important role in reaching out to the private sector and bringing them in and working in a collaborative way, cooperative way with those of us in government to address these problems, because government doesn't have the answers, all of them certainly, nor the resources any longer to deal with the problems, not that it ever did, as we've shown in our country's history.
Well, Mary Jo is a wonderful example, and I'll just give a personal anecdote as well. I'm on the I work, as you know, Hennepin County Medical Center, and we had a family come in with lead exposure, and in fact the house was being condemned, and it was through Mary Jo's effort that in fact we're going to use that transitional housing unit to allow them to have a safe haven until they could find another place to live. So she really is an example, I think, for all of us.
She's probably the closest thing to a saint we'll ever know.
I would agree completely. You mentioned earlier the whole issue of illiteracy and education, and obviously that links to issues of self-sufficiency and being able to really care, both for yourself and for your family. Education has traditionally been more of a local, state type of issue. What is happening at the federal level to really address issues of education, literacy, some of those things? Are those issues that you're presently working on?
We are, Chuck. Certainly we're putting more resources into those early childhood programs, and I think Governor Carlson deserves a lot of credit for emphasizing those early childhood programs at the state level. As we know, the state has jurisdiction for about 95% of the funding of schools, state and local governments. The federal government only about 5%. Federal government's primarily concerned with and directly concerned with the Chapter 1 and Chapter 2 programs, Title I, Title II, children with special needs. But we've worked closely with Governor Carlson and the legislators on these early childhood programs, because that's where we get the most bang for our buck in terms of prevention. We've got to get, as you know, again, as a pediatrician, you've got to get at some of these problems early. I heard a criminologist the other day talk, and he was saying he'd done extensive research on prison, the need for building prisons and so forth, and he said, as far as his research was concerned, the single most reliable predictor of the number of prison cells needed 20 years down the road is the number of 2-year-olds at risk today. I think that's compelling evidence that we need to place our resources, much of them, and our priorities in these early childhood preventive type programs.
And a great example of that is actually a Head Start program, which goes back 30 years or so. Just with, again, some of the changes, what's envisioned for the Head Start program in the future as a model for early education and those type of services for low-income children?
And I'm a big fan of Head Start. I've been a big supporter. You're right. I mean, for every dollar we invest in Head Start today, that saves, according to all studies, $7 down the road in terms of healthcare costs, criminal justice costs, remedial education costs, and so forth. Head Start will continue to be a priority, I believe, regardless of which party controls the Congress. There's widespread bipartisan support for this program. Probably, if I were to single out one program as the most important program for kids, I would probably choose Head Start. Now, one problem we've had in the suburbs historically, we've been disproportionately underfunded vis-a-vis the inner cities. A lot of legislators don't realize that we have some of the same problems here that they do in the inner cities, problems of poverty. Maybe it's more hidden, and it is, but people in poverty, the kids in need in the suburban areas are hurting every bit as much as those elsewhere, and we need to address those problems. Head Start's been a very effective way to do that.
You know, being a pediatrician, we're always interested in issues of access to health care. And 1992 to 1994, there was really a big effort to try to look at some sort of comprehensive health reform. That seems to have taken kind of a back burner at this point. That may be an incorrect perception, and I just wanted to give you a chance to tell us kind of what's happening on the whole area of health insurance reform or access to care for people who presently might not have health care.
Actually, I think this Congress, for the first time since I've been down there, 5 years now, will pass major health care reform legislation. Incremental legislation, to be sure, but I believe this year we'll take care of the portability problem, this year or next, depending on the schedule down there. So if people lose their jobs, they don't lose their health insurance benefits, or move from one state to another, they don't lose those benefits. Two, we're going to take care of the pre-existing condition limitation. If you have diabetes, why should you and your family be disqualified from purchasing health insurance? We're also going to have some, I believe, real administrative cost reform to bring down the cost of administration. I think one element of the Hillary Clinton task force report that made a lot of sense of that bill was a single reporting form for insurance claims. 1/3, according to most studies, as you know, Doctor, 1/3 of healthcare costs go to paperwork, to administration. I was just at a nursing home, and they'd hired 2 new nurses to do nothing but fill out forms. I mean, they're not treating patients, residents, they're filling out paperwork. We've got to do something to bring down the administrative costs. Fourth, tort reform. We need to do something about medical malpractice liability reform. We've already passed that bill in the House, and it's awaiting action in the Senate. So there are some elements of healthcare reform that are going to pass this year, and of course we're committed to saving the Medicare system as well for older Americans.
Well, Jim, and that will have each one of those items will have tremendous benefit for families and kids, no doubt. We've just got a few moments left. Is there any final comment that you'd like to share with the audience about, again, your view on the needs of families and children and how we can really try to maximize?
Let me just digress for a minute.
Sure.
Also, I'm confident that medical savings account will finally become a reality, so that people will be able to save without tax consequences for emergency medical expenses and other health care needs. To address your final question, I just want to thank you for the opportunity to be here to talk about some of these very, very important issues to children and to families, to indeed all the people that I represent and the people here in Minnesota. These are very, very important issues to me, and will continue to be a priority with me in the new Congress. We have to do more with less, to sum up. We have to be more creative in dealing with these problems, because quite frankly our resources are less, and we have to operate within responsible fiscal policy. That's what we plan to do, because we think to mortgage our children's and grandchildren's future is the worst kind of child abuse, to continue heaping this kind of debt upon them. So within that framework, I'm committed to continuing to work in a bipartisan, pragmatic, compassionate way to address the needs of children.
Well, Congressman Ramstad, thank you so much for joining us today. It was really a pleasure.
Thank you, Chuck. Enjoyed it.
Thank you.